Hi everybody, Jackie here with Dr. Dustin Timmerman from the Bilski Dental Group. How are you doing today?
Way above average.
Wonderful, I love that answer.
Yeah.
So I want to talk a little bit about oral health. You know, when you think of dentistry, you know, there's the beauty component of it, my smile and how it looks, and then there's also the health piece of it.
Right.
So when does oral health become really important?
That's a great point. So I think every dentist can probably speak upon this, that, you know, this is like a conversation that we usually don't have to have until we have to have it.
Mm-hmm.
So if I have a 20-something walking into my office and they've had one filling done in their life, you know, I'm going to value certain things, and they have a good, clean oral environment. I'm going to tell them about certain habits and this thing, and that's it. But if I have somebody that's 50s and they've already blown through all their teeth and they have broken teeth down and we have infection and we have to talk about certain things and how the correlation relates to the heart, then that's what we have to discuss.
Yeah.
To me, I just don't understand how we're so divided in the public about getting away with this, and we kind of don't understand. If you had a swollen hip and there's a bunch of pus coming out of it, you probably wouldn't ignore it.
Right.
But in the mouth, we do certain weird things, and I kind of don't understand.
We look past it.
We do, and it's weird. You know, I think, at least from my understanding, everything that's going on in the inside of your body is pretty important on your survival, your health, how you feel, whether you're able to go to work, all of those things. And then the oral cavity is the only one where we put everything in.
Yeah.
So it kind of makes sense that it's a big decisive factor. So, for example, once we get into an area where we're missing a whole lot of teeth and we can't chew as well, so now we're swallowing food whole, food goes down, your stomach has to create a little bit more acid to break it down because your teeth aren't doing it. Yeah. So then we start to get ulcers, and like this is where we start to see
it really
people.
Snowballs.
100%.
It's a big snowball effect for your overall health.
Yeah, I can't tell you how many full mouth rehabs that we've done on large implant cases based off of stomach issues. So it was the stomach that actually told them they decided that the mouth was important.
Wow.
So this happens all the time. But it's very important, 100%.
So what happens when the teeth are maybe browned or black, or maybe some are missing, or you know they're receding or anything like that, but it doesn't hurt? What happens when it doesn't hurt? It just looks bad. So
this is a great point. For my patients, I think there's 3 major layers of the tooth that I try to explain, and that outer covering is the enamel. There's a next weird layer in between the enamel and the pulp, and it has these tubules that connect one another. Okay? So it's called dentin. So as soon as anything passes that enamel, when it gets into the dentin, we know that there's a chance that your body can't defend it anymore, so we are going to watch it grow. Or we're going to do something about it. It's one or the other.
Going to cut it off or watch it grow.
Eventually it works through those tubules. It causes a problem, a little bit of pain. And then this is the bummer. So we get into pain, and then you wait and you wait and you wait, and then the pain goes away, and you're like, well, it must have got better.
Yeah.
And actually what happened is that bacteria got in there and killed the nerve. So now you don't feel any pain, but it's traversing through the tooth and causing an infection. It's like
a cancer with no symptoms or something. It's, you know, it's like you don't feel anything, you don't see it, you don't know that it's there, but it's there. And you can see it, you don't feel it, you think you're good, and it's the opposite. You're actually worse. It's growing, it's infecting you.
And you may be fearful of the dentist, maybe the financial concerns when you went in to have a treatment plan done, and you're like, you know what, let's leave it. And unfortunately, you're just watching a problem become a bigger problem.
Yeah.
So
at the Bilski Dental Group, you guys offer things like savings plans. You guys do consultations with all of your patients ahead of time, and you guys are really patient focused on their comfort and working with them for their individual needs. So we talked in another video about how neglect is expensive. So if this sounds like you and you're worried that you might be neglecting the problem, come to Bilski Dental Group. They will talk to you and work out a solution for you. They will help you figure out what you need. Don't hesitate to call them today at 216-524-4410 or at bilskidds.com. You can book an appointment right online, browse their services, and watch more videos like this to learn a little bit more. Education is really important, so don't hesitate to just talk to a doctor about it today. Dr. Timmerman is here for you, and thank you so much for talking to me today.
Always.